I would say primarily, probably almost 50% of the people I see are people with back pain. Not all back pain is the same. Back pain can be caused by a number of issues, and we have multiple techniques that work to treat and improve your back pain. There are different ways of handling back pain. You need exercise. You also can benefit from manual techniques. And by manual techniques, I'm talking about things that a therapist can do with his or her hands to improve your tissue mobility. So tissue mobility can be mobility of your muscles and of the soft tissue. There's also a type of soft tissue we all have. It's called myofascial tissue. And if you can imagine Saran Wrap throughout your body, it covers your muscles, your nerves, even throughout your abdomen to keep everything where it's supposed to be in your body. And it allows the structures in your body to slide and glide. When you contract a muscle, that muscle is shortening and lengthening, and it has to be able to slide. If that is not happening, that can cause a lot of back pain. So back pain can be muscular in nature, where you have little to no mobility of that myofascial glide. It can also be caused by joints that aren't moving as they ought to. So the spine is made up of vertebrae, and each vertebrae upon vertebrae, there are joints. And those joints can get stiff and stuck. And they can get stiff and stuck because your muscles have gotten tight and you stop moving. And then once you stop moving, you stop sliding that myofascial system. So everything begins to get bound down upon itself. Stretching doesn't always get at myofascial mobility. So you can be one of those people that are home saying, I have back pain, I've looked up exercises, I'm gonna do my stretches, I'm gonna feel better. And you just can't seem to get past your back pain. So what helps is seeing a physical therapist that can work to improve that myofascial mobility and that joint mobility. And it doesn't involve a lot of pain. It doesn't have to be the chiropractic high velocity joint mobilizations, which a lot of people feel uncomfortable with. We do joint mobilizations, but you have your high velocity joint mobs, which are the ones where your chiropractor takes you and turns you specifically and then gives a high energy pop. Physical therapists typically do lower grade joint mobilizations, where it feels more like a lot of pressure to a little bit of pressure to hardly any pressure. I love the techniques that are more like, I call it a joint unwinding. And what it really does is I feel very specifically at each level of the spine, and I'm able to, with just a bit of gentle pressure, to press and see which way that spinal segment is able to move or not move. And then I can specifically, with just a little bit of pressure and patience, just get that joint to move into a range of motion that has restriction. And you'll see that in a lot of people that I work with. They'll be lying down and it looks so gentle, and it really feels very gentle. And people describe it as a release. Once we talk about it, they'll ask, what is that? And it's just the most subtle bit of motion that improves your whole mobility. Sometimes it does take repeated efforts at that. So I do a lot of joint unwinding where it looks like my fingers are just sort of subtly moving, not a whole lot going on. It actually feels really relaxing. I do a lot of myofascial release, and it's not really massage, although it might look like massage. But it's different in that I'm not getting in there and pushing hard and, pushing on tender points that really hurt. It's more of a prolonged, really gentle stretch. So what it looks like is my hands are just moving very slowly. Sometimes what I try and tell people is This is like if you had taffy and you wanted to pull it apart. If you just do it like a really fast pull, you don't get very far with taffy. Taffy requires a sustained, prolonged, gentle pull. So you get taffy to go further if you're just applying a gentle, steady force for a prolonged period of time, and it just eases out. And that's sort of like what myofascial release is. So it's just a very gentle, light, sustained pressure, and eases that myofascial tissue that gets stuck in between muscles and around anatomical structures.